When robotic surgery is discussed, it is often framed as the inevitable replacement for traditional laparoscopy. But from an engineering and clinical perspective, that assumption deserves closer examination. Both robotic assisted surgery and laparoscopy are minimally invasive techniques designed to reduce patient trauma and improve outcomes. The difference lies in how they achieve their goal. HUGO represents a modern robotic platform that adds wristed instruments, 3D visualization, and computer-assisted control. Laparoscopy relies on direct manual instruments, camera systems, and surgeon skill. Neither approach is inherently superior in all cases. In this presentation, it asks a simple but important question: is robotics always better? By comparing HUGO and laparoscopy from a practical engineering-led perspective, we can better understand where robotics adds values and where traditional techniques remain the most appropriate choice. Laparoscopy has been used successfully for decades and remains the backbone of minimally invasive surgery worldwide. From an engineering perspective, laparoscopic systems are relatively simple. They consist of a camera, light source, monitors, and handheld instruments with few moving parts. This simplicity brings reliability. Fewer subsystems means fewer failure points, shorter setup times, and easier troubleshooting. When issues do occur, they are often mechanical or optical and can be resolved quickly. However, laparoscopy places significant physical and cognitive demand on surgeons. Instrument motion is counterintuitive, degrees of freedom are limited, and fatigue can be significant during long procedures. The effectiveness of laparoscopy is heavily dependent on surgeon experience and ergonomics. HUGO introduces features designed to overcome some limitations of laparoscopy. Wristed instruments restore natural hand movements, allowing greater dexterity within the patient. Three-dimensional vision improves depth perception and spatial awareness. From an engineering standpoint, HUGO adds layers of control between surgeon input and instrument motion. These layers enable tremor reduction, motion scaling, and safety constraints that are impossible with purely mechanical tools. However, these advantages come at the cost of increased system complexity. Additional hardware, software, and interfaces introduce new dependencies that must be supported and maintained. Robotics enhances capability, but it also raises the bar for engineering support. Laparoscopic procedures can often be set up quickly with minimal equipment. This makes them well suited to high-volume theaters and time-sensitive cases. The workflow is familiar to most surgical teams. HUGO, this requires more preparation. Arm carts must be positioned, systems powered and verified, and instruments docked correctly. This setup time can be justified for complex procedures, but it may not be efficient for simpler cases. From an operational perspective, workflow efficiency matters. Engineers and theater staff must consider whether the added capability of robotics aligns with the procedure being performed and the resources available. Reliability is a critical consideration. Laparoscopic systems are robust and tolerant of minor issues. A single component failure rarely stops an entire procedure. Robotic systems like HUGO rely on multiple subsystems working together. Power, data, software, and mechanical components must all function correctly. While these systems are designed with redundancy and safety in mind, failures can have broader impact. From an engineering perspective, reliability is not just about design, but about support infrastructure. Robotics can be highly reliable when supported correctly, but the consequences of downtime are greater. Robotic systems can offer measurable benefits in certain procedures, particularly those requiring fine dissection, suturing, or complex ergonomics. Improved precision and visualization may translate into better outcomes in specific contexts. However, these benefits are not universal. Many laparoscopic procedures already achieve excellent outcomes with low complication rates. In such cases, robotics may offer limited additional benefit. From an engineering standpoint, technology should match clinical need. The most advanced system is not always the most appropriate one. Cost is an avoidable part of discussion. Laparoscopic systems are relatively inexpensive to purchase and maintain. Robotic platforms represent significant capital and ongoing service investment. Engineering resources are also a factor. Robotics requires trained engineers, spare parts, and structured support processes. Hospitals must consider whether these resources are available and sustainable. Cost alone should not drive decisions, but it must be weighed against clinical benefit and operational impact. From an engineering perspective, laparoscopy is generally easier to support. Systems are simpler, faults are easier to isolate, and downtime is usually limited. Robotic systems demand more from engineers. They require deeper system knowledge, stricter procedures, and ongoing training. However, they also offer opportunities to work with cutting-edge technology in complex systems. Neither path is better or worse. They simply represent different engineering challenges. Robotics tend to make the most sense in complex procedures where its advantages are fully utilized. It can also play a role in reducing surgeon fatigue and supporting long-term surgical programs. However, robotics should be deployed intentionally. Using it simply because it exists can strain resources without improving outcomes. Engineers play a role in advising hospitals by understanding both the technical and operational implications of robotic systems. Final takeaways. So, is robotics always better than laparoscopy? The answer is no. Robotics is a powerful tool, but it is not a universal solution. Laparoscopy remains highly effective, reliable, and appropriate for many procedures. The right choice depends on the procedure, the surgical team, and the hospital's resources. From an engineering perspective, our role is to support safe, effective use of whatever technology best fits the clinical need. Understanding the strengths and limitations of both approaches allows engineers to contribute meaningfully to surgical, decision-making, and patient care.